Oh my gosh, it didn't even give me the 1, 2, 3. Hi all, it is Lisa Tremayne from the Maternal Health and Wellness Network. Glad you guys are here. I wanted to jump on a few minutes early and see if you have any questions and put them down in comments so that we can get to everybody. I have a feeling that this is going to be a very popular broadcast today because I know as a maternal health nurse that this is just a topic that we're talking about all day, every day. And now being in mental health, it is a huge topic. You know, how is pregnancy different? How's postpartum different? What is my stay at the hospital going to be like? Is my partner going to be able to come? What is my home time going to be? So we're really, really excited to have Dr. Jennifer Schell with us today. She's an OB in Miami. She's a mom herself and is right on the front lines dealing with this. So as soon as she gets on here, we will bring her in and ask her all the questions. So if you want to start by listing them in comments, or you want to wait for her to come on, or you want me to give you some ideas of what to think about. I am a nurse, and I have been a labor delivery nurse, postpartum nurse, a NICU nurse, and am familiar with moms and all they come in with just in a regular day of having a baby. And wondering what the experience is going to be, whether or not they've taken a childbirth class. So now what is added in, especially if it's your first baby, you know, your first of anything, the experience is a little bit more scary because it's the unknown. And then throwing in a little bit of a pandemic might make it a little more sketchy. So we will ask her all the things. She'll be on any second. I'm really glad you're here. And as I can't believe it's only Tuesday of Maternal Mental Health Week, because we are just, all of us in this field are working so much this week, but we love it. We love it. We love it. So if I lose my words or you see me drinking water, it's just to keep up. Also would like to explain that this was hair wash day during the pandemic. And, you know, I have given up, I know the hair, Shan. I have given up blow drying for COVID-19 and am now just letting it fly freely. So it is, this is my hair. This is just what's happening. Hey, Christina. Oh my gosh, I love all you guys. Elizabeth. Hi. I almost said frickin' week, and I don't know if we can say that because I'm from New Jersey, and I tend to run that way. It is, you know, what a time of life, man. It's crazy. So the hair needs its own show. It does, Shannon. Oh, look at this piece, hun. Wait, let me get that one. But it doesn't, the right side doesn't even have anything to do with the left side, which is, you know, I just think we're keeping it real. And also, look, ready? I'm in a bedroom, locked in a rental, which is nice, with bad Wi-Fi up here. But that's how we roll, right? It's just a time when we are who we are. So is anyone on here pregnant? Or is anyone on here newly delivered? Or is anyone on here even thinking of getting pregnant? I've had a lot of women, you know, after snowstorms, we got a lot of babies. Oh, Shannon, Diana, you missed that. We are going to, I don't see her on here yet, Maureen. She was waiting for donuts to come. So she said it would be a couple minutes. Oh, you're 33 weeks pregnant. Yeah. It's a lot. Oh, due on August 4th. It's a lot. So actually, you know, I'm really glad you guys are here because is your, Kat, 35 weeks. Girls, I love you. I love you for showing up. You know, like, is your OB telling you anything? Are you asking anything? Are you being given directions from the hospital? Like, what are you hearing? And what states are you from? Because it is different state by state. I'm in New Jersey. And probably from the news you've seen, you know, we're really, really good at COVID. We're having a lot of COVID. So our experience might be entirely different than someone, say, in North Carolina, right, Jess? Or in Miami, Maureen? I don't know. Is it different because of each area? I would think so. And sometimes I go into work, I work in a hospital, and sometimes I go in and what was true on, hi, Mary Claire, what is true like Monday, like 2 visitors are allowed in, isn't true anymore by Friday because there's been a change. So, and people are being tested. Very good question. Very good question too. I didn't think of that. I'm going to write that down. And what happens if the partner tests positive? What happens if the mom tests positive? What happens, there's just really, really a million questions. So when Dr. Schell gets on here, we'll kind of order them up. I'm going to write them down a little bit while she introduces herself because she'll do way better than me telling you all about her. And I am really excited to see her. Because this has been something on the daily I am talking about. So I'd like to hear someone else's professional opinion. And I'm going to take a sip again. Everyone take a sip of their water. Let's go for you. Yeah, actually. So, Maureen, that's very funny. So in New Jersey, what we're doing is, in my hospital, I'm in central New Jersey, we are doing 24-hour discharge. So moms and partners are coming in. They're both being tested, and then they are both being discharged within 24 hours. Not cesarean sections, but vaginal deliveries. And then it really does change really fast. Boca Raton, and they let her husband and her doula. See, the 24-hour thing is big because the longer you're in a hospital environment, whether it's flu season or COVID season, you are more likely to be exposed. So will you get tested for it in natural labor? Again, it depends on the state. Hi, Dr. Shells. Let me let you in. And it tells us what's going on. Hold on, sweetie. Dr. Jennifer Schell. She's going to come in. I'm going to let her introduce herself. Hi, I'm Lisa.
Hi. I'm sitting outside because my kids are not napping yet and my husband's doing telemedicine in our office. So I'm sorry.
Oh, welcome to my office. It's also a bedroom.
Exactly. That's what we have.
I know.
Our guest room.
I think it's so good to just be real. We all just made fun of my hair. So,
why?
It's natural hair right now. It is a situation.
That's funny.
In and of itself, I'm from New Jersey. I usually have really big hair. I've given up blow drying.
There you go. I mean, yep. I flat ironed the front of my hair, so I won't show you the back.
I'm very impressed. I told everybody a little bit about you, just that how exciting it was to have an OB. I'm so happy to have you take it on. As a nurse, I've been talking to it, so I'm thrilled. I'm going to be your little your little helper out here, and
awesome.
Try and put questions in order, but totally introduce yourself. I can't wait to hear, and I feel like we're going to be friends forever. So I thank you.
How sweet.
Thank you.
So my name's Dr. Jennifer Schell. I'm an OBGYN, and I delivered, I'm assuming close to 2,000 babies, I assume. You lose count. But then I quit delivering babies a year ago in March. And I don't know how it happened. I just got this idea of helping moms because I started thinking about my own deliveries. I had 2 C-sections, and I had struggles with breastfeeding with my first, and I think I self-diagnosed postpartum depression, but I wasn't treated. And, it was kind of like, no, you're not. You're such a happy person. I'm sure you're not depressed. And I'm like, I think I am. Like, I saw the fog, the real fog.
Yeah.
So I think I had it. I'll never know for sure, but I'm pretty sure I had it. And then with my second, I didn't. And so now my mission is for moms not to have mom guilt. That's literally what my company is for.
Huge mission.
The huge mission. Yeah.
Yeah.
So I have mom guilt for like my first child's like postpartum period. I don't think I enjoyed it. I think it was very, it's kind of like a dark place where now I'm like, I wish I would have enjoyed him more. And for those moms who've had this experience, don't worry. Like, my son and I are like this and he's the sweetest, and we're perfect together. It's not gonna ruin the rest of the child's development. It's not
I
gonna
always say
do
the
anything
same
of that
thing. Yep. I
because
always say our love is bigger than like whatever our battle was, whether it was like
yeah,
rage or overwhelm or, obsessing over safety. My guys are older and like they're normal. It turned
yes,
out okay.
they turned out okay. Yeah, he's
They
so far
did.
so good. He's only
Yeah.
3, but no, but he's a sweetheart, and he comes and I have like stuff on my shirt that I wanted. I was wearing for my video thing, and I have ketchup on it because he came and hugged me with ketchup in his mouth. So don't worry, your kid will still love you, and you're still a great mom. So anyway, my mission in my company, it's called Concierge Postpartum Care,
Good.
is to care for mothers. I also care for mothers who've had miscarriages, which I think is a very underserved population. I had several before I had my kids, so I understand it firsthand. So again, it's all about the mom guilt for me. I want to avoid it, whether it's helping you try the breastfeeding, and if you later want to give up, you give up, and I teach you how to give up. If you want to turn into a pumping mom, that's fine by me. It's whatever the mom wants, I try to do for them. And now I have a pretty good following on Instagram, which is super sweet because they're all engaged. It's not just like I didn't buy followers. I didn't do any of that stuff. And I get invited to like, oh, let's get you more followers. No, I don't want. I want them to find me because they need me and they want to hear what I have to say. I don't want empty followers. And you can tell whenever I put a question box, I get so many questions, and I enjoy helping moms with the questions. Sometimes they DM me, which they shouldn't, and I just say use my question boxes because it's not medical advice. I'm just trying to help them in my mom experience and my experience as an OBGYN.
Yep.
Just still in my brain and will always be there. So I was very happy that you guys invited me to do this because moms are so scared, and I'm pregnant. I don't know if you know, but I'm
I
pregnant
saw
with my
on your
third.
Instagram. I stalked you
So
a little bit.
yeah. So I love it. So basically, I've gotten a lot of moms calling me very overwhelmed about this whole COVID situation, which is scary to all of us. And we're all in the same boat in that we're discovering, new information daily. And it's scary not to know all the information. Like I was telling my husband, he's now starting to go to the office more. And he's an ear, nose, and throat surgeon. So, of course, he's up in people's
Oh
faces.
boy.
So I get anxiety because of whenever he goes to the office, but I understand we took an oath and we help people, and I'm extremely proud of him. That doesn't mean I'm not going to be scared because nobody has done any studies on if I get COVID and, the child gets, whether the child gets affected or not.
I know.
We don't know in 5 years if that's going to do anything because the child got it in the uterus. So that's another thing. But, we can't, and advice I give people and I give myself is we can't go there. We can't control it. We can't go there. Just don't go there and try to live in a bubble. Don't watch the news that much. Be informed. Like for example, I don't know if you saw my stories, but I had neighbors gathering over 15 people with music and doing a conga line, and they had masks on, but I got messaged back, and they legitimately thought that because they were wearing masks, that was okay. And I don't know. I mean, it's hard for me to believe that, but I'm a doctor, so I have the information. So maybe there are people out there that don't have the information that wearing a mask does not mean you can get close to someone.
Right. They just think that's like an armor, and then just go crazy.
Maybe
Scary.
that's what they think. And sadly, I see people that wear a mask and then pull it down and stuff, and touch it. And
touch it.
So I'm scared that this thing's going to continue because people don't have the information. So yeah, don't get obsessed with the news, but also inform yourself. Like maybe pick one person you can ask things to. You can ask me on Instagram. My question box is that's totally fine. I'll help as much as I can. You can pick your doctor. You can pick, one news channel a day for like an hour.
Yeah.
Something like that, but some reliable source of information. Or just maybe that friend you have who's on the news. Like we all have that friend who's like obsessed with the news. Maybe ask that person
everything.
A daily report. Maybe that person can tell you a daily report. So things like that. So
that's brilliant.
Moms are nervous about bringing their babies home. So I just want to help with that. Do you have any questions already in the little box?
Yeah, they were asking some before, and also because my patients are all pregnant or postpartum, like I can tell you all the ones they're asking, and I feel like it's cut just like you said into the trimesters almost.
Yeah.
Like so if I just found out I'm pregnant, is COVID a threat? And what do we know? And just what you're saying, right? Like it's changing so fast. But maybe if we go in trimester order, it would be cool to
Okay.
give
Yeah, yeah,
some
yeah. You guide me.
questions.
Okay.
Thank you. Thank
So,
you.
okay. So as first trimesters, everybody is at risk for COVID, for getting it. Now, babies at risk, there are simply not enough studies. Nobody's going to volunteer to get COVID and have their pregnancy studies, obviously. And this hasn't been going on long enough for us to have the information either. So, what I'm going to say here is based on what I've studied and common sense and just what I can tell you. But it's not going to be 100% because I'm not an infectious disease doctor either. So
Absolutely.
for first trimester, I have read some studies of miscarriage. Now, that doesn't mean if you get COVID, you will have a miscarriage. Because, for example, if you have a kidney infection in the first trimester, you can have a miscarriage. Any
Mm-hmm.
infection that you get in the first trimester can put you at risk of a miscarriage. I
Right.
had the flu first trimester. I did not have a miscarriage. So it doesn't mean that if you get COVID, you'll have a miscarriage or the flu or a kidney infection. But it
It
does
could
mean
it could affect it, right? Yeah.
your
And
risk.
we know like 1 out of 4 women, right? You're one, I'm
And
one.
miscarriages are common already.
Yeah.
So it may not
It'll be
even
hard to say.
be COVID. So it's hard to say. That's the answer.
Yeah. Yeah.
Second
That's
trimester.
my favorite answer.
Yeah, I know.
It's up there with, just like you
I
said,
hate
like
that
what are we
answer.
going to do? Yeah. All
Yeah.
right, so how about second trimester? I'm in the
So
happy
second trimester.
place. I feel better.
Yeah. So second trimester is always the happy trimester, and it's the trimester that honestly is the strongest. Meaning, if you're gonna have elective surgery or a surgery that
Right.
can that shouldn't really wait until delivery, but it's not emergency based. If you need emergency surgery, you get it no matter what trimester.
Yep.
Like you need to get it. But let's say you have gallstones and they're bothering you and they hurt and this, but it's not like they're making you, your liver die or your gallbladder
Yeah.
die. Like it's not affecting you that much.
Pancreatitis.
Yeah, like it's not pancreatitis. So you should get your surgery in the second trimester. So it tells me that I can say if you're in the second trimester right now, it's not that you're going to go out there and do the conga line like my neighbors with mask on or no mask on, but it does tell me that you can be more at peace. That's the strongest trimester.
I like that. I
Yeah,
like that. This is good.
yeah.
And then the third trimester, so I'm due in June and
Preterm
July
delivery
and
is what I
August,
would worry
right?
about the most.
Yep.
Going into labor because any infection can put you at risk of labor. And honestly, water intake is so important in the third trimester and the postpartum period. Now it sounds silly, and actually just saying it makes me thirsty, and
I know, look.
inside. I left my water bottle inside. But so drinking water. If you don't drink water, your doctors always tell you need to drink water because if not, you're going to get contractions, and it's true. But we kind of forget to tell you why. So I like explaining things to people so that then they're like, oh, let me do this because it's actually not BS.
There's a reason.
Yeah, there's a reason. Even though I'm going to have to be annoyed and peeing every 5 minutes, I need to do
Exactly.
it. So if you don't drink water, you secrete antidiuretic hormone because you don't want to diurese because you want to keep the few drops of water you have in your body, you're going to keep them inside. An antidiuretic hormone is super similar to oxytocin, which people commonly know as pitocin. So your body's going to think you need to contract. So that's why you drink the water. So you don't secrete antidiuretic hormone that's like oxytocin/pitocin. So there you go. Drink water.
Yep.
But yeah, third trimester, I would say, if I had to say which of you guys should be more worried about COVID is the third trimester people, which I'm 25 weeks. I'm getting there. So fun for me to say.
Yeah.
And realize I'm one of them. But
Yeah.
it's true. I mean, third trimester is the most dangerous for, I would say, preterm labor and complications because you can have pneumonia and you have this increased intra-abdominal pressure, pressuring up here in the third trimester to your lungs that are
Pressing to your
there.
lungs.
And so then decisions will have to be made of an early delivery to save the mom's life. We don't take this lightly. we will not deliver a baby preterm because you get COVID, because you're COVID positive. No, we will deliver a baby early if you're about to get intubated,
Right.
or if you're intubated already, and we need to decrease that intra-abdominal pressure so you can get better and be a mom. So it's a very hard job to be an OBGYN. Sometimes we have two patients at least, sometimes more than two.
Yeah.
And we take the husbands into consideration too. I mean, we care about the husband's well-being as well. So we take care of families. So it's not
right. It's not just one person. So say you're a mom, I'm seeing this one. Say you're a mom who's been fine and everything's okay, and you plan on going in and having a regular vaginal delivery. It could be your first baby. You've never had any experience. What should you expect in the hospital? So when you're going in, what's going to be different? And I do wonder, you're in Miami and I'm in New Jersey. We're in city type areas. It's different than somewhere else. But what would you say?
What I've heard so far is nationwide, they're kind of doing the same thing. I know New York moved to the whole no visitor thing, and that was like a big deal, and people like kind of rebelled against it, and they changed it back. I have a lot of mixed feelings about that, to be honest with you, because I think as a pregnant woman, and I also think as a doctor.
I know.
And sadly, some people were caught lying, like people with fevers and with COVID lying, and that's why they made that decision. So I'm not completely against that decision.
I know.
I am happy for moms that they get one person there, but I really am urging anyone who's listening to us to please not lie and be honest, because they can not only just affect their wife and their baby and the nurse in that room or whatever, but that nurse sees other patients. That doctor sees other patients. You come in contact with surfaces that other people are going to touch. So please, if we want this to end, we need to stop lying and lying to yourselves and thinking that wearing a mask means you can have a conga line.
Yeah. And I think there's just a lot of, people didn't get and maybe don't get, that
we think it's invincible sometimes.
And also, like, I'm not going to affect you. I'm protecting, but I'm not. I'm coming in as a nurse in a very, liquidy environment, and I'm going to be, but then I'm going to the next room, then I'm going home, and then I'm touching everything. So I don't think people think they're doing it out of malice. Like, no. They think like, oh, I'm not sick. And they don't know any better.
That they could do it out is also selfishness.
Yeah.
I'm sorry to say, like, sometimes it is selfishness. Like,
if they know. Oh, absolutely. Yep.
Or laziness too, because I'll put my neighbor example of the party again. If they weren't sure, they should ask someone. Call your doctor and ask, listen, I want to do this. You think if I wear a mask, the doctor will definitely say, hopefully, don't do it. Or if you're doing it, set markers where people can stand, that are 6 to 8 feet apart. But anyway, answering your question, the things that I've heard that many people in Miami at least are doing is when you get there in labor or to be admitted, before they would make the visitor, because they're allowing one visitor, they would make the visitor wait in the car until you knew if you were being admitted or not, because a lot of people go for labor and they get sent home because they're not in labor. Which is one of the services I offer. Like, I'm doing these calls, and one of them is like talking to the person one-on-one, saying like, this is when you need to go to the hospital, because you want to avoid, sorry, I have like mascara. You want to avoid unnecessary trips to the hospital, honestly.
Yeah, good. Good.
So anyway, that's what they were doing. Now I'm being told also that they're testing everyone for COVID, which is great.
Me too.
Not the antibody test, the PCR, because the antibody test, we don't know what that means. We don't know if you're immune if you have it. So if you tested positive for antibodies, then it can also cross-react for the regular coronavirus. It's just a cough and a cold that you've had in the past. Everybody has a coronavirus news for you, but not COVID-19. Like,
So true.
Yeah. So what was I going to say? So, so they're testing everyone, and they wait until the result is back, because it's a quick comeback, and then they let the visitor come. So that means some women are laboring by themselves a little bit, because they're, and I don't want to say by themselves, without their visitor, because I love L&D nurses. Like, if any of my L&D nurses are watching, I miss you so much. I love L&D nurses. They're passionate about helping moms. And I always say, like, they love the first time moms. Not that they love them more than the other ones, but they know they need more. They need more TLC. So
Yep.
I'm sure nobody's going to leave you alone to labor and pain, okay? Like, and, you know, we know which patients are freaking out or need more TLC than others, and they'll be there. Like, they'll hold your hand until your husband gets there. So somebody
Yep.
asking everyone, including support partners. What does that mean?
Are,
Oh, it's being tested.
is
No, no,
being
no.
tested.
The patients are being tested.
In
The
my
patients.
hospital in New Jersey, they're testing partner and mom.
There you go.
So
So
that's what I mean.
as
It's
far as
so
listen,
different.
as far as I know, because I'm not delivering at hospitals actively, so I don't get my information immediately. I can immediately text the nurse right now or one of my buddies and ask, but I'm not 100% sure. But maybe.
And it might really be different. Like if you're somewhere in North Carolina and you don't have the kind of dense population you and I have, they might be a whole different situation. You know, when I was a labor nurse, I could
guess
have
it
5
depends on
patients.
the lockdown that they're having, and now they're starting to open up certain things. Our hospitals are going to start doing elective surgeries now. But anyway,
Yeah,
to
me
not
too.
get sidetracked.
Yep.
So that's
So
what
this
happens.
one
So
is saying
maybe,
how amazing labor and delivery nurses are.
I
She
know,
stayed
I
by my
saw.
side the entire time. I mean, when I was a labor and delivery nurse,
Yeah.
you know, everyone becomes the right
You were a
kind of
labor and
nurse.
delivery nurse? I did not
Uh-huh.
know this.
Yeah,
Oh,
yeah.
no wonder.
I know. That's how
Yeah.
I started out, L&D and
So,
postpartum and then the
you guys,
nursery.
like, you guys are there for the patients. I mean,
Yeah.
an OBGYN is nothing without an L&D nurse and without a postpartum nurse. Like, we need you guys, or it doesn't work. I mean, we're not there for the entire process.
It's a
So,
team. It's a team. But no one would ever leave a mom alone. Ever, ever, ever.
ever.
No,
I want them
no.
to not fear that. They will
I
not
know.
be alone. Yes, it's a stranger, but believe me, you make friends with those L&D nurses.
Well,
Like,
you
and
bond really
and if
quickly.
you
Yeah.
bring them a donut, woo, or pastelito in Miami, you bond even better. I always tell them, bring a little something of snacks with you when you go into
Oh,
labor.
yeah. Yeah.
Because
For
it
everybody.
makes a difference. Like, it's like, I don't know, it just changes the mood. People get happier. I don't know.
A little bit of a party.
Jackson is too. Mom and support person will be tested. This is for Miami. Thank you, Cindy.
Yeah.
So maybe Baptist is doing it. If anyone watching right now is from Baptist Health System, please let us know. Then maybe, or they're about to do it. Like,
It
they're
changes
kind of
so
all doing
fast.
the
Like what
same
was
here.
a
So
rule
I may be wrong.
yesterday? Yeah, it might
Yeah.
not even be a rule today. And now that we're reopening,
I'm gonna
it
actually
could
text and
change the
ask.
other way too.
Yeah.
And then my hospital is discharging patients at, this hair is hilarious, at like 24 hours. Is yours doing that?
Not necessarily. Hold on. I'll answer that question in a second.
Okay. So that's,
Are
I'll just talk while you're doing that.
partners at Baptist when they get there, question mark, or just patients?
We are discharging at our hospitals in New Jersey 24 hours if mom and baby are safe, just to not keep them in that kind of,
They're offering it.
Yep.
They're offering it. Said mom and support person will be tested. Oh, there you go. That's what
I'm
pretty sure is going to happen. Yeah.
Yep. And she was at Baptist. Yep.
Perfect. So that's what they're doing then. So my bad.
And it's good to just know it's coming, right? Like if you get there and you're surprised, I think you're
I want to
already
talk a second about how they test you.
Please do.
Because my husband's an ENT, so ear, nose, and throat doctor, right? So when this all started, I had a terrible sinus infection, like horrible. But I had gotten those infections during my pregnancy, but I was, of course, now freaking out about COVID because COVID's around now. So we forget we can get any other infection. It's all COVID now. Got a cold, it's COVID. So you sneeze, I have COVID.
I had it twice in my head for like 2 hours. I didn't have it.
So my husband had in the very beginning, he had some kit that maybe we could have sent it or whatever. So he actually swabbed me. And then, I know exactly how far it has to go, right? Because an ENT doctor swabbed me, so they know exactly how to do it.
Yep.
So I experienced it, right? And then we decided to do the right thing and just go through the means, go to the hospital if I really need to be tested and not send it. So we tossed it and we're like, we're not doing this. So, because that's what happens when you're married to doctors. So then I went to the hospital a week later, and when they tested me, they actually did not do it correctly, which scared me so much.
They tested you?
Me, and they went, one of the ER nurses. But it doesn't mean, I'm not trying to say nurses and doctors, like, this,
but that there is, right?
Nothing to do with title.
Way.
This has to do with training someone.
Yep.
a monkey can do this test, okay? Anyone can do this test if they're
But they
taught
have to know.
correctly how to do it. So I'm not, that's why I didn't want to, I said a person because I didn't want to say it was a nurse versus a doctor. Like I don't care about title.
True.
It's how they did it. So they did it like I felt it here, like I felt it high in the nose. But this
Right.
is a nasopharynx.
Yep.
And you have to understand because people joke around, they're going to go to your brain or whatever.
Yeah.
No. It
It goes
actually, you're
down.
supposed to aim it down. If you look at the anatomy, the tube goes down. It doesn't go up. There's nowhere to go here.
Yep.
It goes down. So you should feel it
Oh,
all
yeah.
the way past your nose, like almost like at your throat.
Like gagging, yeah.
Like almost gagging or like,
Yep.
oh, like almost. I don't think you gag because it doesn't get down there.
No.
But it gets pretty deep.
Yeah.
So I spoke up and I was like, okay, I'm going to make a decision. Either I wasted my time just now, possibly exposing myself, pregnant, and I'm going to get a false negative, or I'm the BITCH who's going to say, listen, my husband's an ENT, and I know that for a fact that I was tested and
that wasn't good,
chose to be the BITCH. And then I had to go to the ER doctor and be like, listen, your nurse tested me wrong. Can you please test me? And I felt really bad because again,
I know, but you're right. It was
title.
education. Yeah.
But they need to take responsibility and
Yeah.
teach whoever is doing it
Yep.
to do it correctly. And he did it, and I felt it where it was, and whatever it was negative, thank God. But I just wanted to take a moment and make sure that you all know how
that was a good
do
idea.
this test and speak up if your test was not done correctly, instead of being like, oh, mine didn't hurt so much. They didn't go that
I was
deep.
just going to say, all the people who are like, wasn't that bad? I'm like, you didn't get tested right. It's unpleasant.
I mean, but it's but it's also your personality. I'm a really good patient. You can poke and prod me everywhere, and I don't think it's that bad. Like, I didn't think it was terrible, but you have to understand that it has to be uncomfortable and past your nose. Like, if you feel it just in very deep your nose, that's not correct. So speak up. This is for everyone, because a false negative.
Yeah, you don't want to have the test and then not get the benefit of really knowing. Another question I have from somewhere else is, how about the postpartum period? After you deliver and go home, who do I know I can let in, or what do I do?
Okay, so that's very common. So what I have a post on my feed that you can find it. It's a black and white photo. It's actually my mom seeing my daughter for the first time. It's a very cute, emotional photo. And it's a post about exactly that, like, when do you allow the grandparents to see the baby? So, and I'm going to substitute grandparent with whatever person you want to, share this baby with, right? So you have to understand that you're going to deliver, hopefully at a hospital, and you are at risk of contracting COVID there. And you can be asymptomatic for 2 weeks. Some people can be asymptomatic for a long time and never have symptoms and spread it. But we're not going to go there because we can't go crazy either. So I can't say, oh, don't let anyone see the baby until this pandemic is over, which obviously would be the perfect correct answer.
Exactly.
That's really the perfect correct answer. But in reality, what would I, Jennifer Schell, what would I do? Because I am having a baby in August. And let's say August comes and this situation is the same. Or, there's a second wave. People talk about the second wave. Like, we don't know. What I plan on doing is, sadly, my family doesn't live here. So my parents and my husband's parents would have to travel. I would not want them to come because I would feel so terrible if they caught this on a plane or traveling.
Yeah.
So that makes me very sad, obviously.
Yeah.
And I know my mom is devastated by this, and my mother-in-law, and I'm sure, the men express it less, but I'm sure they're not happy about it either. But, it's hard for everyone, and it's hard for me. I mean, it is my third, so I know what to do, and psychologically, I'm probably doing better in that sense than a first-time mom, or like this mom who's having the first grandchild of the family. I get that. So, and it breaks my heart, but I have to answer this question as best as I can.
Yeah.
And the answer that I would give is, if your parents are traveling by plane, I would avoid that if possible, especially now. I don't know what's going to happen in August, but I'm saying if I'm having a baby now, which I hope not, this baby needs to stay.
Yeah, don't do that now.
But exactly, no. So anyway, so I would say the person can drive. I keep saying person, but it's whatever, grandparents or whatever you want. Have to understand that you're at risk of bringing the virus home. So that person needs to understand that they're taking a risk if they come before those 2 weeks.
So is mom also, like, let's think about it the other way. So what if first time mom, should she be worried about having her mom, dad, best friend, girlfriend over so that, her postpartum plan was to make sure sleep was part of the plan, or to have, someone come and stay for 2 weeks? What do those people do?
So I canceled my night nursing service because I have a night nursing service, and I canceled it because they work at hospitals. My night nurses are actual postpartum nurses from Baptist and Mount Sinai and South Miami and whatever, and they work at hospitals. So I don't think it's worth it to take a risk like that right now.
Right.
And I am someone who considers sleep a very important thing and
Me too.
support at home the first 2 weeks. I think it's
Me
a
too.
medical necessity. I really do.
Me too.
I don't think it's just like, oh, I want to be lazy and not breastfeed and sleep. No, moms breastfeed with the night nurses, and they still don't. They're sleep deprived still, but less.
Yeah.
And
Yeah.
you support it so the anxiety is less. But that's another topic.
Yeah.
But I would say the person that's coming should quarantine for 3 weeks before your due date, because due date means you're 40 weeks. A lot of women don't make it to 40 weeks. A lot. Like most of my patients that I'm clients, I say patients, clients are like delivering between 37 and 39 weeks.
Yeah.
Like almost none are making it to a due date that I've talked to. And when I was in practice, yes, a lot of them did it, but I would say 50-50. Like I don't think it's that many that make it to 40 weeks. So I would say quarantine for 3 weeks before the due date, in case you don't make it, to the due date, for them to protect you guys. But then how do you protect them is also waiting maybe till the baby is 2 to 3 weeks old.
Right. It's so interesting that you have to assume you have it, and then what is your response? And then you have to assume who you're having in has it, and how do you respond to that? So that's been the question. That's what I've been saying too. Like,
you guys can wear masks at home and do a lot of hand washing. I don't think gloves are necessary. If you're wearing gloves, for crying out loud, don't put it down.
I think we all need those dog cones. When you take your dog to get spayed. Like the first couple of weeks this was happening, I was like, oh my God, I touched my face again. What is wrong with me?
Yeah.
It's hard. Oh, here's one. I have a question. Second trimester, how do you feel about prenatal yoga classes or exercise? Maybe not right now, but in a few weeks.
So I'm 25 weeks. I'm loving, and this is nothing, like I don't even know the person. I'd love to meet her. Body Fit by Amy. She's on YouTube, and I'm doing these exercises, and I totally approve, like, because I obviously every time I watch something like that, I'm like, what are people like teaching pregnant women, So, but she does the movements very, very appropriate for pregnancy. She divides her videos in first, second, and third trimester. She does modifications for everyone. She looks amazing, which is inspiring to me.
Yeah.
So I want to have a crush on whoever I'm following as an exercise person. So I enjoy the videos, and I'm doing those at home. So I would do that for sure.
I can share that. So that's Body Fit by Amy on YouTube.
Yeah, I love it. And then as far as like prenatal classes and breastfeeding classes, honestly, my packages are awesome. I'm not trying to sell like that.
No, that was perfect timing. I was going to say, tell me what you're doing. What is postpartum concierge? Because I love the name of it.
Has changed now, and it's more like prenatal postpartum concierge, and it's women that want to discuss questions about since the OB visits sometimes are a little less. They kind of ask me preliminary questions that they can ask their OB. I'm not giving medical advice. I'm just guiding them as what questions they need to ask their doctors based on their worries. Like they're worried about being pushed into a C-section, which is so sad because the majority of us really don't want to do that.
Yeah.
It happens because there are bad doctors, there are bad nurses, there are bad therapists, there are bad, of every profession. But the majority of us go into this to help mothers, not to push a C-section. So it makes me very sad when automatically people think that.
Yeah.
But that being said, I guide them into, okay, your doctor, when do they think normally people need a C-section? How long do they let you labor after your water's broken? Like, And most answers from the doctor are going to be like, it depends on the case. If your baby looks good, we let you go. Like, you know, all this stuff. And it calms them down because they see that we're not trying to go after them or give them Pitocin unnecessarily. But like yesterday, I was telling a mom, I'm like, if your water breaks and you don't have any contractions and it's been 4 hours, you know, and you're not getting contractions either, like you're still the same, don't lie to your nurse or your doctor saying you feel more pain, because all you're doing is prolonging the Pitocin.
Yep.
And increasing your risk of infection. And I
Yep.
said that both the couple and her, they were like, oh yeah, it's true. You know, and they understand, because if you speak to a human being, they understand. And sometimes we don't have time to speak. And with this COVID pandemic, you don't have time to speak.
Have you seen a big shift?
For my services?
Yeah, I was just going to say that.
And I'll send you an info email. If anyone
So how
wants
do people
prices,
reach you? And we'll put that on here
so
too.
on my Instagram account,
Okay.
Schell Cares, you can DM me your email, and I'll send you an email with the info packages. They can just directly text me their email address to 786-338-3088. That's probably the best way, honestly. I respond pretty quickly to text messages.
And I will share this, everybody, so you don't have to do the mad scramble.
Thanks. But
You're
as
welcome.
long as I have their email, I can send them the info email with the pricing. And I have a sale going on now too. So because of COVID and all this stuff.
Yeah.
And I have a Mother's Day sale of actually one call. To be honest with you, the one call, I did it just so that you can gift it to someone, like as a Mother's Day gift.
So good.
Yeah, because I thought, but it's actually working out where moms are like, actually a lot of husbands are gifting it, which I believe that's a great gift.
Yeah.
And it counts as a gift. But a lot of moms are just like, I just want to get it for myself, which is great. But for sleep training, because I do early sleep training, and that starts around 5 or 6 weeks, and it's not like crying it out or anything terrible like that, and we follow what the pediatrician's telling you, like individualize it and all this stuff. That one call is not good for sleep training, because a lot of moms are, I want to do a sleep training for $50, you know, because one call for $50 is the same.
Yeah.
I'm like, it's just not worth it, because you'll end up buying the basic package anyway, and then you just spend $50 you didn't have to spend. So I
you didn't even
don't
need.
take advantage of people. I explain it, and then they're like, oh, okay, fine, then I'll take the basic package.
So you could take women anywhere. They don't have to be in Miami.
No, they don't have to be
That's
in Miami
awesome.
at all. Yeah, I'm helping someone in California. So, yeah.
Have you
So it's
seen a
pretty
big
cool.
change
Super
in your
rewarding.
practice because everything's virtual now? Have you seen such an increase?
Yeah.
Yeah.
Like, I'm pretty busy. Like, I feel like I'm busier now because I used to do just home visits. And, I mean, a lot of things work really well virtually.
They do. I didn't realize it until we were forced to do it. I was like a big naysayer. I just love people and hugging and touching and, you know, and feeling a labor and delivery nurse. And it really, I really was unhappy. And then we did
yes, I can do it for women who live anywhere.
Anywhere in the world. That's what's happening. This is going to cause a huge change.
Just contacting me, and someone in Canada I'm helping actually.
Yeah.
We just have to work with the time change. That's the only thing.
Yep. So you really can help women, pregnant, any trimester, postpartum. We're talking moms and babies.
With miscarriages who get pregnant after a miscarriage, they need help.
Oh,
They're anxious. They think it's going to happen again.
Oh,
That first trimester is so terrible for women who've had a miscarriage before.
Yep. They wind up with me a lot too, because, you know, we deal with perinatal mood disorders. So infertility, loss.
Yeah. It was hard though. That was mean.
So that, cause you're not drinking water.
Yeah, I know. I need to go drink water. Yeah,
See? So, are there any other questions, everybody? I'm gonna, and so they can find you. Tell me your Instagram handle again.
So it's Dr. like doctor, Schell, it's my last name, Schell Cares. Dr. Schell Cares.
Good.
Is my Instagram, and then my phone, my direct phone number, which is right here, is 786-338-3088.
And I have all that, and I will share it on everything.
Yeah, I got a text from an L&D nurse. She said just patience at Baptist, Maine, at least.
Yeah.
So,
I really do think it's...
Listen, she may be at home right now, and when she comes back to work tonight, they may have changed it.
That's
like changing.
That's what I'm finding. I would literally go in the morning, nothing. Go in the afternoon, hazmat.
Yeah.
I'm like, okay, so stuff has changed. But just like you're saying, that really is the disease. We don't know, you know, and as we know, we change. So, and giving the moms this information and giving it to them in that, even in that one call is brilliant. Brilliant. Yeah. I love that.
If they need one call, I mean, aside from the early sleep training, one call can make a difference a lot. Like even in the latch, like even that mom who just wants to be prepared for when she delivers. Like I think that call.
Ooh, I froze. You froze or I froze. There you go.
I think that one call is great for third trimester moms.
Yeah, yeah.
Can you hear me? Yeah.
That's really, I really like this. I think this is great.
Yeah, because I teach them like my latch trick, and then they're not just going into this whole breastfeeding thing, you know, just expecting the lactation consultant at the hospital to help, who may be busy at the moment that your baby's crying, you know. Some people have used it just literally at the hospital. Just like when they're there, they're like calling me from the labor room, like just baby just came out 2 hours ago, and they're just like, I need the latching help. So that helps, and the whole like, you know, when to really go into the hospital and stuff, and when to call their doctor, stuff like that. So
you're like a really good,
glad
educated best friend
a lot of
that everyone can reach out to, and get really validated, evidence-based information. I think this is brilliant. I'm very excited. I think you're a smarty pants.
Thank you. And for my followers, can you tell them who you are? Because I see a lot of people like from my account also there.
Oh, good. So I am Lisa Tremayne. I'm a small part of a collaboration because we know that it's going to take 1 million of us to change the world. So our organization, where all of us are, is the Maternal Health and Wellness Network. I am also an RN that runs a PMAD program for what used to be called postpartum depression in New Jersey, and work with another foundation called the Bloom Foundation, which just helps to educate moms and find resources no matter where they are if they need help after they have a baby with anxiety or depression.
Oh, there you go.
So
yeah, I have a whole theory of like depression and anxiety too that we should talk about. Like I feel like postpartum is different than just regular anxiety and depression.
Oh Lord.
Like a lot of things, like even this whole breastfeeding thing is very attached to and I feel like it can cause postpartum depression or anxiety. Not breastfeeding, don't get me wrong, I'm so pro breastfeeding. But this whole guilt and like making a mom do it without like teaching them like
100%
easier way, like, you know, it's
or what
not
if mom
like,
doesn't want to? What if mom doesn't want to and you don't know?
Don't want to, and they make you feel terrible.
And that's okay. And if we're starting out saying someone's in a, don't even get me started, you know, in a baby friendly hospital, and so now there's no nursery, there's no bottles, there's no pacifiers, and you're automatically assumed to be breastfeeding. But what about me? Like, what about the moms? Like, what about if we just say, Mom, how do you want to feed your baby?
Friendly hospital thing, they have to be careful.
Yeah.
Because sometimes it's too pushy. And I think the times that I've had a mom that's having issues with breastfeeding, and I actually give them the option of like, listen, you can pump if you don't feel like latching the baby at that time or whatever, they end up breastfeeding.
I know. As soon as you take away the pressure of, you know, how do you want to feed your baby? I don't care. And your baby's not going to know. It takes that pressure off them. Or you talk to their mother-in-law.
And then they want to. Then they feel like, oh, let me try this again.
Or like, I guess it's no big deal. Yeah. Oh, we have to have a whole conversation.
We do.
About that. Thank you so much.
Thank you.
I'm going to share everything on here so that everybody can find
you keep it on your story or something. I think you keep it for 24 hours.
It'll stay on stories for 24 hours.
I wonder if I can share that. I wish I could share this on my, I don't know, whatever.
I'll ask the smarter people to share it. And then we certainly will. And I really enjoyed it. And I'm probably never going to let you go now.
Okay. Bye, guys.
Thank you. Bye.
Bye.
Whoop.